Hi, I'm Dr. Derick Lindquist. I am the Dean of the Jindal School of Psychology and Counseling, and I'm happy to welcome you back to our ongoing series, Mining the Mind. Today, I'm going to talk to you about a really fascinating story. This is actually one of the things that first brought me into neuroscience 20 some odd years ago. I'm going to talk to you about split brain surgery and the effects it has on these patients. Now first, we have to again review and understand that there's two hemispheres, right? Now, we haven't discussed the idea that each hemisphere controls the opposite side of the body. So my right hemisphere is responsible for moving my left arm and my left leg, as well as the sensations I have through them. And of course, my left hemisphere would control the right side of my body. In addition, each of the two hemispheres has specific functions that we attribute it to it. Okay? So the left hemisphere we usually think of as more logical. And for most people, about 96% of all people, that is where your language centers reside, is in the left hemisphere. The right hemisphere is more creative, more spatial in nature, more holistic. Okay? So the language here is the important part, and is something I'll come back to in a moment. Now, connecting the two hemispheres is this really big bundle of nerve fibers, or axons, as we referred to them earlier. This allows the two hemispheres of the brain to communicate with one another. If we go back many decades, 50s, 60s, even into the 70s, for individuals that suffer from severe epilepsy, meaning they were suffering from seizures, a last resort to treat this was to go in and sever the corpus callosum. That is, to disconnect the two hemispheres of the brain. So they actually went in and they would cut these nerve fibers. As a result, the two hemispheres are no longer able to communicate with each other, and these patients were referred to as split brain patients. Now, it's true that this did not entirely cure them of the seizures, but it did at least diminish the severity, because the seizure could not travel from one hemisphere of the brain to the other. And this is a historical technique, something done in the past. You don't see it today because we have drugs and other things that can be better utilized. Nevertheless, there is an individual by the name of Dr. Michael Gazzaniga who worked with these split brain patients for decades, and his results are fascinating. So first, what we know is that these patients, after they recover, they don't really notice that anything is wrong. Everything sort of seems the way it was before the surgery. But what Dr. Gazzaniga showed through careful psychological testing is that in fact, each of these two hemispheres can act independent of one another. That is, each hemisphere has a, quote, mind of its own. So to see this in operation, let's just take a look at one of the tests he would do. Imagine I have a patient stare at a screen. In the middle of the screen, we have this plus sign, right? And I say, look directly at the plus sign. Now, I can flash pictures or words in the left visual field, so to the left side of that plus sign, or to the right visual field, to the right of the plus sign. And again, that information is going to be processed in the opposite hemisphere. So the kitty cat here on the left is processed in the right hemisphere, the dog on the right is processed in the left hemisphere. That's it, that's the idea. So by staring at that plus sign, I can selectively target or input words and pictures to one hemisphere or the other. So if I take a split brain patient and I do this, I say, look at the plus sign, and in the right visual field, I show this word face. That's relayed to the left hemisphere where the language centers reside. I ask the patient, what did you see? And they readily tell you, I saw the word face. No problem, right? Quite easy. But if I flash the word face to the left visual field, it's now processed in the right hemisphere. The right hemisphere does not have language capabilities. It cannot verbalize what it saw. Does that mean it wasn't aware or it didn't recognize the word? No, in fact it did. How do I know that? Because I can ask the patient, okay, I know you say you didn't see anything, but could you draw a picture of the word? In this case, the left hand, being controlled by the right hemisphere, draws a picture of a face. I can also do this through touch. So if I present a bell, for instance, to the left visual field, processed by the right, and I give the left hand a bunch of objects to feel, it can feel the bell and select it. showing that the right hemisphere is aware of that incoming sensory information. What is the right hemisphere good at? Well, it's not language, but it's really good at, again, visual spatial stuff, things in your environment. So if I present a puzzle, these 4 little cubes that you have to put together, if I allow your right hand to do it, controlled by the left hemisphere, the right hand is pretty unsuccessful. If I allow the left hand to do it, controlled by the right hemisphere, this patient can readily put that puzzle together. Okay? The left hemisphere, logical, language-centered. The right hemisphere, visual, spatial, more creative. And the right hemisphere is actually really good at being able to recognize faces of people that you know as well. So these experiments show that each hemisphere in these split brain subjects, again, they can act independently. They can sense the world, they can execute motor actions, and amazingly, each side can actually have its own memories. So these early researchers argue that the separation of the hemispheres creates 2 independent spheres of consciousness, 2 sets of consciousness in a single head, in a single cranium. So the 2 independent consciousness are similar, but they're not identical. They may have different past history, different memories, different concepts of self, family, or their own personal history. And in fact, these early researchers often refer to the 2 hemispheres as though they're people, right? The left hemisphere is mad or upset with the right hemisphere today. Now, what's cool is we all try to make sense of the world. We all do this. This seems to be localized to the left hemisphere. So Gazzaniga called this the interpreter. The interpreter tries to make sense of the world even when there's incomplete information. Okay, so again, let's look at the example here. We're showing a picture of a snow scene with a house to the left visual field, processed by the right hemisphere. A chicken claw, which is processed by the left hemisphere. So I then show a bunch of images and I allow the subject to pick them out. Left hemisphere, I saw the chicken claw, so I'm going to pick out the chicken with my right hand. Right? The subject knows why it's holding a picture of a chicken. But the right hemisphere selects the shovel with the left hand. The left hemisphere has no idea why it's looking at a picture of a shovel. It simply doesn't know, right? It has no access to the right hemisphere. So the left hemisphere tries to make sense. It confabulates a response. That is, it reaches back into its past experience and it tries to come up with a plausible answer. In this case, this is the left hemisphere speaking. You need a shovel to clean out the chicken shed, right? Very plausible. That's why my left hand is holding this picture of a shovel. So what Gazzaniga argued is the interpreter resides in your language dominant hemisphere. This is the voice in your head, right? When you talk to yourself, that interior monologue, that is coming from that language dominant hemisphere. Amazing. And it gets a little bit even more weird, because one of the side effects of this surgical procedure, split brain surgery, sometimes the 2 hemispheres come to the point where they act autonomously against each other. And in fact, they can actually work in opposition to one another. That is, the left hemisphere controlling the right side of the body tries to do one thing, which is counteracted by the right hemisphere and the left side of the body. So autonomous control of the opposite hand of each hemisphere. And this can lead to the left hand, the right hemisphere, acting in ways that the left hemisphere doesn't understand. And again, the left hemisphere is you. That's your interior monologue. That's you thinking and controlling your own behavior. That's the left hemisphere. But the right hemisphere, the left side of your body, is doing things you don't understand or you don't want it to do. In other words, these subjects exhibit alien hand syndrome. The left side of their body, controlled by their right hemisphere, is doing actions, engaging in behavior that the left hemisphere does not want to see. The sufferers of alien hand feel that they have no control over the movements of the alien hand. Instead, the hand has its own capability of acting independently of their conscious, voluntary control. And it can do really complex acts. So if I am buttoning up my shirt with my right hand, my left hand can come in and unbutton them. Right? It can remove clothing. It can manipulate tools. In the little image here, this is a woman slapping her face with her left hand controlled by her right hemisphere. Unwanted, but she has no control. Now, this term was put forth by a French neurologist who acknowledged years later the alien hand syndrome, which sounds like something out of a sci-fi movie or TV series, right? It's not a great term. A better term would have been autonomous hand syndrome, but we're stuck with it. So let me leave you with a quote. Again, this is from Michael Gazzaniga. The patient would sometimes find himself pulling his pants down with one hand and pulling them up with the other. Once he grabbed his wife with his left hand and shook her violently, with the right hand trying to come to his wife's aid in bringing the left belligerent hand under control. Once, while I was playing horseshoes with the patient in his backyard, he happened to pick up an axe with his left hand. Because it was entirely likely that the more aggressive right hemisphere might be in control, I discreetly left the scene, not wanting to be the victim for the test case of which half of his brain does society punish or execute. Right? Amazing story. This I just was drawn to. I loved it when I was a young person. This is what got me into behavioral neuroscience. I hope you've enjoyed, and I look forward to seeing you next time.